In this presentation, I would like to explain to you about causes failure of the total hip joint replacement. First is the infection. Infection can be happen in some condition where disease such as the diabetes. We all know that diabetes patient has a high sugar level in blood as well in their cells. Open wounds cannot easily be treated because the bacteria is attracted to sugar. Second, the infection also can be happen when patient gain weight. So the main mechanism that are causing loosening is the wear particles. Wear particles is the microscopic fragments from the prosthesis that can lead inflammatory reaction. By time, inflammatory reaction can eat away the bone surrounding the prosthesis that can causing loosening. Mechanical cause can happen when patient gain weight or lift up heavy weight. We also believe that total hip joint replacement support upper body weight in the certain limits of weight. This can cause serious injury towards patient when ceramic can be broken or damaged, metal can be dented or bended, and also it can happen to dislocation.
My name is Muhammad Hazib bin Azman. My point for overcome failure hip joint replacement is first, infection. Minor infections in the wound area are generally treated with antibiotics. If the bacteria gain access to the implants, they may multiply and cause an infection. Successful of injection, antibiotic can avoid infection area of plant. Second, for aseptic loosening, to minimize the risk of instability and prevent early loosening. Porous bioactive coatings on metallic parts are regularly used. The coatings induce and promote cell infiltration, which decrease the time required for new tissue formation. My last point for mechanical causes, to lower the risk of mechanical failure, monoblock flat tapered stems are recommended by some authors, even in revision hip arthroplasty. For cup failures, uncoverage of the cup resulting from loss of bone stock, such as hip dysplasia, can be managed with screw treat cups, although these two can concentrate the stress of the implant.
Hi, my name is Muhammad Lutfil Hadi bin Muhammad Zaim. This medical device, nature of body contact is bone to bone. For contact duration, durable and lasts around 15 to 25 years before structure deterioration. The category is long term because it's above 30 days. Next, biological evolution of the total hip joint replacement. This according to ISO Part 1. Long-term implants. Cytotoxicity is a term used to describe the process of determining the toxicity or irritancy potential of materials and chemicals. Second, sensitization. Assess if a substance includes chemicals that have harmful local or systemic effect after repeated or prolonged exposure. Third, intracutaneous reactivity or irritation. Using sites like skin or mucous membranes and usually in an animal model, determine the local irritation potential of device, materials or extracts. Fourth, material mediated progenicity, to identify pyrogenic for fever response after exposure to a medical device, biomaterials or extract of. Fifth, acute systemic toxicity, a method determining the toxicity of chemicals and other substances as a result of various exposure. Sixth, acute toxicity, to assess the new drug's risk of side effects. Next, subacute toxicity, to assess the new drug risk of side effects. Subacute chronic toxicity, used to determining the effect of a material and on a patient after repeated exposure. 8. Chronic toxicity, a test for occurrence of adverse effect after repeated administration of a test substance over long period of time in a test species. 9. Implantation effect, evaluate the local pathological effect of a material's sample on living tissue. 10. Genotoxicity, method for detecting chemical that cause genetic damage through a variety of process. And lastly, carcinogenic, assess the potential thermogenicity of medical device and biomaterials. Thank you.
Ini is not Clarima bin Ahmad Samri. So for main component of total hip joint replacement is a femoral component is for fixation part is PMA, stem and head is combat cranial alloy. Acceptable component part for cup is cobalt cranial alloy, backing is metal, and for fixation is screw or press fitting. Design consideration for total hip replacement, prosthetic hip components are optimized to provide wide range of motion to prevent dislocation. Must enable implants to support loads. And lastly, femoral stem is designed with sharp corner in order for bone in contact marry cross or resolve. Chemical consideration for femoral head, acceptable and femoral stem is for chemical properties, stable in air and does not react with water. For acceptable is magnetized, and lastly, femoral stem is hard ferromagnetic.
Next, for the design consideration for the total hip replacement, we consider the cobalt chromium alloy for three parts of the artificial hip joint, which is the femoral head, acetabular cup, and also the femoral stem. We move to the mechanical properties of the femoral head. It is excellent wear resistant and large in Young's modulus. For the acetabular cup, it has a favorable strength, which it can withstand the load of the patient when the patient is standing, walking, and doing the daily activities. For the femoral stem, it has a high corrosion resistance and it can be implanted in body patient for a long time. Next, we look at the morphological properties of the femoral head. It is tough. For the acetabular cup, it has a hard surface, which this tool can give the enough support for the patient's body, especially for the lower part of the body. Lastly, for the femoral stem, the cobalt chromium alloy is a biocompatible metal which it does not react with the blood and the surrounding of the patient's inner body after it be implanted. So it is suitable to be inside of the body for a long time. So that's all from me and that's all from us. Thank you.